Thank you for listening in. Today I'm going to be talking about my study, which is looking at the effects of an exercise program on premenstrual symptoms in premenopausal women experiencing PMS and PMDD. I'm personally interested in this topic because I myself have PMDD, and I'm very interested in finding different holistic modalities for treating it. I'm also interested in pediatric and perinatal care as well as overall women's health. This study is looking at premenstrual syndrome and premenstrual disorder. Studies have shown that anywhere between 75 to 90% of women experience some form of premenstrual symptoms. This can last anywhere from 7 to 14 days of a woman's cycle, so this is 50% of the time that they would be within their menstruating years. These symptoms can include depression, anxiety, irritability, fatigue, breast tenderness, bloating, weight gain, among many other symptoms. Premenstrual dysphoric disorder is the more severe version of PMS and is diagnosed in the DSM-5. Hormonal birth control is typically prescribed to help manage these symptoms. However, there's really limited research on other more holistic ways of treating PMS and PMDD. With that, I'm looking to determine the effects of a 12-month lifestyle intervention on premenstrual psychological and physiological symptoms in premenopausal women with PMS and PMDD. Based on previous research, I hypothesized that participants in the intervention group will see an improvement in PMS and PMDD symptoms and stress scores by the end of the 12 months when compared with baseline. In this study, I'll be recruiting between 100 and 150 minimally active women between the ages of 18 and 35 that have symptoms of PMS or PMDD for a majority of their cycles and are willing to engage in physical activity in order to improve their symptoms. They'll also be asked that they are not currently on any hormone-altering substances such as birth control or chemotherapies or antidepressants like SSRIs. As for our methods, during the first visit, we'll have all of the participants come in and perform screening, informed consent, as well as a physical activity screening to ensure that they are safe for exercise. We'll also collect baseline data as well as distribute educational materials for both groups. The intervention group will then meet 3 days per week for 50-minute sessions that will include cardio and strength training exercises for the 12 months. And the control group will be asked that they do not make any alterations to their current physical activity habits. After the 12 months, we will then collect follow-up data. Some instruments that we'll be using for this study include the premenstrual symptoms screening tool, which is shown here on the screen. And this is going to determine what different symptoms women are experiencing during their cycle. We'll also be using the Flow menstrual cycle tracking app, as well as a fitness watch that measures resting heart rate. With the data that we get from the resting heart rate watch, we will take the average of the resting heart rates on the women's menstruating days and subtract that from the average of their resting heart rates on their non-menstruating days and compare those differences between the intervention and control groups. We will also be using a mixed factorial statistical analysis, and a p-value of less than 0.05 will be considered statistically significant. So bringing this all together, we know that there's limited data on safe and effective treatments for managing PMS and PMDD, and I also found that there's very limited data done in the United States. All of the studies that I was looking at while doing my research were done outside of the US. But we know that so many women experience PMS and PMDD and that it can last for such a long time and be so severe, but there is very limited evidence-based interventions that are available that aren't using hormonal birth control or other pharmaceutical drugs. Here are my references. Thank you so much.